Welcome to Humanautic, unlocking the secrets inside your body and brain. Imagine this: a single bubble of air, smaller than a pea, traveling through your bloodstream. You might think, so what? But that tiny bubble can stop your heart, block your brain, and kill you within seconds. Sounds unreal? It's called an air embolism, and it's one of medicine's most terrifying hidden killers. Hey everyone, welcome back to Humanautic, where we explore the science behind the human body's most fascinating, and sometimes frightening, mysteries. Today, we're diving into the question: what really happens when air enters your veins? Is it truly deadly, or just a medical myth? Let's find out. How it happens. Normally, our circulatory system is a closed system, blood flows, but no air gets in. But air can enter the bloodstream in a few situations: during IV injections or catheter insertion, if the line isn't properly flushed; during surgery, especially in the chest or brain; from injuries to large veins in the neck or chest; even while diving or flying, when pressure changes rapidly. When air sneaks in, it forms bubbles that travel along with the blood, and that's where the real danger begins. What actually happens inside? When a bubble of air enters a vein, it doesn't just disappear. It can travel to the heart, and from there, into the lungs, blocking blood flow, just like a blood clot. This is called a venous air embolism. If the bubble reaches the arteries, it becomes an arterial air embolism, which can block oxygen to the brain, heart, or spinal cord. Result: chest pain, difficulty breathing, low blood pressure, confusion or loss of consciousness. Just a few milliliters of air, as little as 3 to 5 milliliters injected directly into a vein, can be enough to stop blood flow in critical areas. What it feels like. The person might suddenly feel dizzy, short of breath, or faint. Their skin might turn bluish, and in severe cases, they may collapse. Doctors can sometimes hear a mill-wheel murmur, a churning sound from the heart caused by air bubbles. It's rare, but unmistakable. Real-life cases. There have been chilling real-world cases. In one instance, a patient died after just 20 milliliters of air entered through an IV line during surgery. Divers are also at risk. If they ascend too quickly, nitrogen bubbles form in their blood, causing what's known as the bends, a form of gas embolism. Even in hospitals, this remains a rare but known emergency, which is why medical staff are trained to remove every single air bubble before giving an injection. Treatment and prevention. If air embolism is suspected, immediate treatment is crucial. Doctors may position the patient in left lateral decubitus, left side down, to trap air in the heart's right atrium. Give 100% oxygen to help the body absorb the air faster. In severe cases, use hyperbaric oxygen therapy, a high-pressure chamber that forces the air bubbles to dissolve. The best treatment, though, is prevention. That's why medical lines are carefully primed, syringes are checked for bubbles, and divers are trained to ascend slowly. So yes, air in your veins isn't a myth. It's rare, but it's real, and it can be deadly in the wrong circumstances. Next time you see a nurse tapping out air bubbles from a syringe, now you know exactly why. Thanks for watching Humanautic. If you learned something new today, hit the like button, subscribe, and share this with someone curious about medical science. And tell me in the comments, what topic should we uncover next?